Hello, my name is Julia and this is Kirsty, and we're both nurses working for the Royal Osteoporosis Society. We're going to spend the next 15 minutes or so talking about something that a lot of us are finding quite common nowadays, and that is communicating with the doctors and nurses that look after us via phone and video appointments. Obviously, the pandemic really had a big impact on the way that we communicate with doctors and nurses, and COVID forced us to rethink the way we work in healthcare, and some of those changes have stuck. Phone and video appointments have become increasingly common, and the chances are that your next doctor's appointment will be over the phone or via video. They can seem daunting, but there's lots we can do to prepare ourselves, and being aware of what to expect can really, really help. And hopefully this session will help set your mind at ease. So Kirsty, there are some advantages, aren't there, to telephone and video appointments?
Yeah, that's right. Actually, there are. There are simple things like you don't have to travel, which can save you time and money. And of course, the NHS, we all know how they're struggling. You don't have to wait around in hospitals or surgeries. And obviously, lots of people are worried about any kind of continued risk of getting an infection whilst you're amongst other people in that sort of setting. I think a useful thing to point out is that a lot of people think that these aren't somehow as good as traditional face-to-face appointments, but actually, a lot of the time, you may not need any kind of physical examination or actual tests done to you. So it would have been a simple talk anyway. So doing it over the phone or via a video appointment is just as good. But some people do still find them a bit challenging, and that's completely understandable. And that might be just because you don't feel so confident talking on the phone or by video, or you might find it difficult because, it's something new technologically, or there might be, other issues like, hearing or vision problems. But there are some things that you can do before your appointment to try and make things easier and make sure that you do get the most out of the precious time that you have. So should we start with phone appointments? Because these are becoming increasingly common.
Yeah, obviously, in advance of your appointment, you will have received a letter or an email or a text, which will tell you when it is, the time and the date. It's worth checking just to see what sort of appointment it is. If they use words like virtual appointment or online consultation, or they send a link to a website, it's likely to be a video call. You do need to make sure that your hospital or your surgery have got your up-to-date correct contact details, your telephone number, etc., or your email address. And it's worth, before the appointment, just having a think and writing down the list of the symptoms you're having, the questions that you have or concerns. What do you want to get out of this appointment? Make a note of all that and refer back to it during the appointment so you can really make sure you've covered what you wanted to say. Yeah, you can make a note of, if your osteoporosis history, for example, when you were diagnosed, the bones you've broken, any pain you're having, the tablets you're taking, supplements you might be using, your DEXA scan results, have it all to hand so that if it is useful to be brought up during the consultation, you've got it there.
Yeah, definitely. And it's also worth thinking about whether or not you might want to have a friend or a family member with you. You might want somebody else to maybe listen in or take notes for you. If you want to do that, and it's a phone call, you could put the phone on loudspeaker so that both of you can hear what's being said. And obviously, if you're not sure, if that's something you haven't done before, check out how to do it before the appointment so you feel confident at the time. It's also worth having your last medical letter to hand, if you've had correspondence from the hospital before about previous appointments. So if there's anything in that you want to pick up in this appointment and ask about. I think it's worth thinking about things like choosing a good place. So have a think about where you're going to have the appointment. If you've got a nice quiet place, if you're in a household, say maybe with grandchildren or other people, or even in a work environment, minimize any background noise if you can, somewhere where you won't be disturbed. And the simple practical steps, make sure you've got your glasses. If you wear hearing aids, make sure you've got them in. Make sure that if it's a phone appointment, your landline connection is working, your Wi-Fi is working, or if you're using your phone, your battery's got charge in it. All of those sorts of practical steps. And it's worth just noting that if you do have a phone call from the hospital, it's likely their number won't appear on your screen. It's likely to say something like phone number withheld. So be aware you might be wanting to answer that call rather than dismiss it. Obviously, have a pen and paper just in case you want to make any notes about anything. And at the end of the appointment, just clarify, just ask what the next steps are. Make sure that you understand anything. And if you're not sure, ask.
Yeah, thanks, Kirsty. Video appointments, onto video appointments. These can seem quite scary because a lot of us aren't used to communicating via video. It may be not something you've done before. It may seem intimidating, but it's probably the nearest thing to a face-to-face appointment, which of course we're all very used to. And for most of us, it's probably the technical side of things that can seem worrying. But again, there are things you can do beforehand that can help. Now, there's obviously equipment that you're going to need if you're going to have a video consultation with a doctor or nurse. You obviously need a desktop computer, a laptop, a tablet, or a smartphone with a built-in camera and a speaker with microphone, and obviously a web browser like Google Chrome or Safari. If you're unsure about any of this, you can ask family members about the technical side so that they can make sure that you're set up in advance. Again, you need a good internet connection, and by that we mean really something good enough to watch a YouTube film, for example. So if you know you can do that, you're likely to be all right. You need to have enough battery or data allowance left on your internet plan for your call. And again, as Kirsty's just said with the phone calls, make sure you've got somewhere quiet and private and well lit, because obviously you will be seeing your doctor on the screen. Have a comfortable chair, a notepad and pen again. And if you use a tablet or a smartphone, if you're using your iPad, for example, you can prop it up on a pile of books or a cookery book stand, which are really good. So it stays steady and you can write notes. If you're using your smartphone, it might be useful to connect to the Wi-Fi. If you have it, it's likely to be a better connection and you won't be using your data.
That's right. And I think a lot of people will be thinking, well, how do I join this video call? What's the actual process? And usually it's by visiting a web page. Usually your hospital will have sent a link. You don't have to download anything particular, any software or anything special. You will just be clicking on a link they've sent you, and they'll be giving you instructions on how to join in advance. So it will be something along the lines of click on this link, or, an invitation will pop up on your screen, which you click on, or you might have to type an address into your website browser like your Google Chrome. You may need to enter some personal information or a passcode you've been given to join the call, and that will all be in your letter that came with the appointment. And once you've joined, the doctor or whoever it is that you're speaking to in the appointment will probably ask security questions to make sure they're speaking to the right person, which is completely to be expected. It's natural to find video calls a bit strange at first, if it's not something you've done much of, but they do get easier and you'll get much more comfortable as time goes on or with practice. And if you're unsure again about any of it, have somebody with you who can help you connect to the call.
Yeah, and there are some tips to help you relax and get the most out of your video call. For example, when the nurse or doctor appears on your screen, say hello and wave. They'll do the same. This helps you check the sound and the video are both working. You don't need to look directly at the camera. Look at the doctor or nurse's face on your screen. That works well and it feels more natural. There may be a small delay in the connection, which means that you speak over each other a bit from time to time. This is really common in video calls, so don't let it put you off. Just be patient and take the conversation slowly. If you have any technical problems, let your health professional know, and they'll make sure you don't miss anything important. And again, ask if you need anything to be explained again.
Absolutely. And whilst you're in the appointment, like any appointment face-to-face, your healthcare professional is going to tell you the reason for the appointment, ask you questions about your health, make some assessments about how things are going now or what might need to be done. They'll discuss their opinion. They may make some recommendations. They'll give you the opportunity to ask any questions. They'll hopefully summarize the next steps for you and then tell you again if they need to see you in person or if there needs to be a follow-up appointment or anything further like that. So again, take notes if you want to, it can help. Also, your healthcare professional will obviously make a written record of the appointment. So there will be an appointment letter sent to the GP, which you can always ask for a copy of.
Brilliant. Thank you, Kirsty. Well, that's about it for now. We do hope this session will make phone or video appointments a little bit less daunting for you. I think knowing what to expect and being prepared is half the battle. And most importantly, it ensures that you get exactly what you need from the appointment. Don't forget, you can visit our website for lots more information on osteoporosis and bone health, or phone our free helpline to speak to one of our specialist nurses like Kirsty and myself. So cheerio for now.
Bye.